Hello, everybody. Welcome back to the Sliding Scale podcast. This is the second episode where we decided let's just talk about the questions that kept getting asked to us on our social media handles, and let's just get to it.
Yeah, hi guys, welcome back. So here's the first question that we have been asked quite common. And the question goes something like this. I'm not very good with anatomy. Will I able to learn with practice? Anirudh?
Okay, it's a very frequently asked question, not just by people on social media, but basically anybody who I come across in my wards and teaching, and. So the short answer is yes. So you can skip to Narendran's answer for the next question if you want to, but the short answer is yes. You will get better at anatomy, but the key word here is repetition, right? Anatomy is a very volatile subject, and remembering anatomy is like, I would like to equate remembering anatomy like any other fine motor skill, right? Say, for example, you're picking up a fine motor skill like playing the guitar or learning a new instrument or even learning a new language for that matter. You need to keep repeating certain pathways for it to become spinal to you. So I'm reading this book called Thinking Fast and Slow. It's a great book. So I've only gotten to like the first 50 pages of it so far. In that book, the basic concept is there are two systems in our brains. The author calls it System 1 and System 2, where System 1 does all the mindless spinal jobs, and System 2 is involved in more deliberate active thinking kind of stuff. And some of the experiments on the book are pretty cool. You should actually check it out, right? So similarly, anatomy will be very deliberate and very repetitive when you start with, and as you do it with practice, it gets to a point where it becomes spinal. And for this, I think you need to have very good resources. One atlas, any atlas that you like. I used what was the one that we used? Netters, yes. We use Netters Atlas, yes. So I use Netters Atlas, and Themes is also good, but Netters also has a surgical approaches, Atlas for surgical approaches, and any standard anatomy textbook. I loved Gray's, but it was too cumbersome for me to read during my residency. So I got this small book called Lee McGregor's Synopsis of Clinical Anatomy, which is a really cool book. Purely because it's very straightforward, it's very simple, and it's very small. So you can carry it around everywhere and read whenever you get the chance to do so. So have an atlas, because imagining anatomy without having encountered it before is very difficult. So having a good atlas is very key to understanding anatomy. The second thing is have a textbook that you can refer to it very often. But most importantly, like I said, it has to be repeated, right? So I've spoken to you about this. Do you remember that Siddhartha Mukherjee's book that I spoke to you about called The Laws of Medicine, where he describes like a really cool surgeon?
Yeah.
uh, yeah, so I read that where he says if you can't name it, you can't cut it, right? Which was really cool. um, the story goes that is like a really big old, like oldish surgeon, very cool teacher, called the Scalpel or the Hawk or something, and people used to be terrified to assist with him. But the good thing is he used to teach you so well that lessons are long lasting. So the thing that he used to say all the time is if you can't name it, you can't cut it. This is something I told my senior, who I had a really good rapport with during my residency, and we just followed it religiously. So whenever we were operating, we made sure that if we don't name something, we don't have the liberty to cut it off. So it ended up being a habit for us, right? So what I ended up doing is during any procedure, it doesn't matter if I was operating or if somebody else was operating, every time that I'm operating on any part of the body, I try to name every structure that I see, right? And if I don't name something, it used to feel horrible, right? It used to feel really terrible about it. But I used to go back, refer to my atlas, refer to my standard textbook, and I knew. To this day, there are anatomical structures that I keep learning about, even in simple cases, supposedly simple cases, like a hernia repair. There are so many things that you can learn every day. So learning anatomy has to be equated to a fine motor skill, where initially you'll have a period of frustration, and then you'll have this moment of eureka where you realize how things work, and then it's just a point of improving on the skills that you already have. So spaced repetition, follow your textbooks, good textbooks, and make sure that you don't cut if you can't name it.
Yeah, I think that if you can't name it, you can't cut it is a great line to carry through your life. I think that's important. And I think what you said is absolutely right. Is that what ultimately matters is practice, and the deliberate practice, like how what we talked about in the last episode, is what's important. So I think that in your practice, to get the most out of your practice, there are some things that you have to keep in mind, because oftentimes we practice skills, but we end up getting frustrated because we don't get good at them. And if you find yourself in that situation where you're weak at anatomy, or you're weak at, I don't know, reading ECGs, or you're weak at ABGs, or whatever it is, whatever skill you're trying to get better at, and you're practicing but you're not getting better, there are four things that you should keep in mind. The first thing is deliberate practice, which means that you can't just pick up something and expect it to just get into your brain through diffusion. You have to make sure that you are deliberate about what you practice, and like which subset of whatever bigger skill that you're trying to get better at. It's important to make sure that you hyper focus on that particular thing. The second thing is many repetitions. And for this, the thing that I tell my juniors, especially when it comes to things like ECGs, is doing at least three ECGs every single day. So over a course of 3 year residency, that's over 1,000 ECGs. So even if you're looking at just normal ECGs, that's okay. But the idea is to make sure that you put in the time and the effort so that you consistently get better. And the third thing I think is timely feedback, which ties into like either having a good mentor or a good senior who tells you when you're making a mistake. So if you're just practicing, but you're practicing it the wrong way and there's nobody to correct it, you'll end up with faulty technique. And having faulty technique in your fundamentals is just a recipe for disaster. So make sure that you have somebody to give you timely feedback. And the last thing is having a good, valid, and conducive environment. So a lot of times people who are in toxic environments, they still learn, but they don't learn effectively and efficiently. And it's always easier to learn something new when you're in your comfort zone, and then apply that thing when you're pushed outside of your comfort zone. And operation theaters and emergency rooms are like this. So the more you prepare, yeah, in peace, the less you bleed in war, is how it, I think the more you sweat in peace is less the less you bleed in war, is how the saying goes. So I think making sure that your environment is conducive to studying is important. So these four things you got to remember. First is deliberate practice, repetitions, timely feedback, and valid environment. And if you are able to hone all of those things and practice in those particular aspects, I think practice will really make you perfect.
I absolutely agree with everything that you said, especially the point where you said learning faulty techniques and proceeding to keep doing that all your life, right? You need somebody to actually pull you back and tell you, hey, you're doing this wrong. And you need to have it in you to be able to accept that, yes, you have made a mistake. But the problem here, the problem that I have faced personally is having to unlearn something and relearn something, right? That takes a lot of effort. So, but unfortunately, a lot of situations you're having to make do with what you have, and you end up learning the wrong things. So, I mean, I think that the lesson here is more than deliberate practice. If you know that your technique is faulty and you have sound evidence that it is faulty, you should be able to have the humility to accept that it went wrong, and okay, these things happen, and unlearn it and try to learn it back in the right way. And that line was killer, by the way. Sweat more in peace and you'll bleed less in war.
Yeah, I think it's
Hopefully not real patience,
yeah,
which segues to our next question, right?
yeah.
So the next question that I'm sure you've been asked multiple times and I've been asked as well is, the first year of residency is extremely frustrating, right? You're just overwhelmed with a lot of sensory information. You have patients to manage, you have complications to handle, you have toxic seniors, you have thesis work to think about. And at the end of this all, when something bad happens and you feel responsible for it, that's just the final nail in the coffin. So making mistakes is something that never feels great, right? And it's something that makes you feel like you have to question your reason for existence. So how did you handle mistakes, and what are the lessons that you want to tell people about handling mistakes during residency?
Yeah. So I think there are a lot of cliches about making mistakes, like mistakes are the stepping stones to success. A person who never made a mistake, never tried anything new. The only real mistake is the one from which we learn nothing, and then making mistakes is better than faking perfections. And the list is endless, but the reason that it's so hard to learn from mistakes is because we let the mistakes define us. Once you accept that a mistake defines you, you've set a ceiling for yourself, and breaking that ceiling and pushing past it is almost impossible. So there was this experiment that was done with houseflies where they gather a bunch of houseflies, they put them inside a box, and the way the houseflies fly is they jump really high, and then they sort of take flight. But the problem was the houseflies were hitting the ceiling of this box, and they couldn't really get past it. And at that point in time, what ended up happening was once they removed the box, the houseflies were still jumping only to that height which the box had set for them, and they weren't able to jump further than that. And the point that I'm trying to make is that if you're going to make mistakes, and you're going to keep making mistakes, but if you let that mistake define you, you will constantly be, uh, constricted by the fact that you've made this mistake, and you'll always be afraid that you're going to make this mistake, and that fear will induce a sort of paralysis, and you'll never want to put yourself in that situation again. So when you make a mistake, you just have to take a step and stop, think about what you did wrong and what part of that was in your control, what part wasn't in your control, and work on fixing the part that was in your control, and the rest of it is just a kind of a cautionary tale. So treat your mistakes like you would treat a bad movie. Just because you watched one bad movie, it doesn't mean that your taste in movies is bad. You will watch good movies, and the bad movies just tell you how to choose movies better. But the answer is never to completely stop watching movies, and that's the takeaway. If you make a mistake, it's okay. You gotta, work the courage up to make more mistakes and learn from them.
It blows my mind how good your lines get, honestly. I'm waiting for your book, one day hopefully you'll have
Working on
your
it.
own book.
Working on it.
Yeah, working on it. So I actually agree with everything that you've said, because mistakes are actually an unfortunate part of any profession, right? You hear about short circuits, you hear about building collapsing, you hear about roads caving way, you hear about a lot of these things. You hear about safety measures failing in cars, when, I mean, a job of a car manufacturer is to give you a safe car. But these things do end up happening, but everywhere there are fail safe mechanisms, right, to make sure that they don't happen. And I think fail-safe mechanisms have developed as a result of all the mistakes that have been made in the past, right? We spoke about this in the last episode. Learning something for yourself from your own mistakes is smart, but learning from somebody else's mistakes is wise. So always look out for people who make mistakes, not to judge them, I'm repeating myself again, but to make sure that you find out what went wrong, and you make sure that you don't do anything that will result in a similar outcome. The problem with our profession is that mistakes are very high stakes, right? They're very costly. They can end up with the loss of a life, a limb, a loss of livelihood, prolonged admission or prolonged ventilation, whatever you name it. It's just a very high stakes game where the mistakes are very costly. But like you rightly said, these mistakes should not incapacitate you, because you cannot let it define you, in the sense you're going to be facing a similar problem in a different patient at any given point in your life in the very near future. If you're going to think about how not to make a mistake before you even commit to treating the patient, you're going to severely handicap the way that you're going to look at the patient's problem holistically. Imagine having a surgical a complication, and complications happen to every surgeon. There's a very famous quote in one of a non-academic but sort of academic book that says every surgeon has a complication. If a surgeon claims that they don't have a complication, it either means two things: they're lying, or they haven't been operating. So it's either one of those things. So complications happen in all surgeries, And in any field, to be honest with you, misdiagnoses are pretty common, but the thing is you need to catch them in time, and that comes with experience. But that's not what I'm trying to say. Imagine if you make a mistake in a surgery, and then next time you hold a scalpel you get tremors thinking about the mistake. You're setting yourself self up to the same failure, right? Despite knowing for a fact that you may not commit the same thing again. So it should not incapacitate you. And like you said, Narendran, you need to dissect from it, take a step back, let it not define you, and learn what went wrong. The best thing that you can do to honor the mistake that costed somebody some important part of their life is to make sure that that mistake doesn't happen in another patient or another scenario once again. The blunder is not the mistake, but not having learned from the mistake, right? So there's a very cool thing that my senior used to say. I don't know where he read it from. I'm pretty sure he didn't make it up on his own. He's not as good as you. He used to say, if you do a mistake, if you do something once and it goes wrong, it's a mistake, right? But if you do it twice, it's a habit. So let it not define you, let it not define you, your profession, or anything of that sort. But make sure it doesn't happen again, and don't let it bog you down.
Yeah, so those were the two questions that we wanted to tackle this week, and hopefully you found those helpful. Thank you for tuning in, and we will have more such fun information for you next week. Take care. Cheers.
Thank you, everybody. Cheers.